Question 1. When I was working in an aged care facility, I noticed that one of the residents that is normally very calm or very compliant with what we ask of what we ask of her, was starting to get a little bit agitated. She was getting snippy at things, like, and I mean, at first it made sense, the things that she got snippy at, like another resident taking her water or something like that. That made sense. So nobody kind of questioned it further. It was just like, oh, okay, whatever, she might just be having a bad day. And then that was around morning time, and then around afternoon tea, which was about like 2 hours later, we noticed that she was asking to go to the toilet quite a bit, quite often, too close of a gap in between. So obviously she's toileted in the morning, she goes to the toilet when that was her morning routine, and then she'd come out for breakfast, and then if she wanted to, we'd toilet her again, and or she would stay in the lounge room. So she was continent. She was able to verbalize that she wanted to go toilet. So she was continent, both with urination and feces. So she was bowel control. So she was, she was continent. Anyways, she wanted to go toilet way too often, and it wasn't even about the often. It was just that it was way too close of a gap in between the times that she wanted to go toilet. Obviously, we still take her, and she's one of those residents that don't want you in there, understandably. So we always wait outside, because she's not a false risk or anything. And we can hear in when when she's going to the toilet, and it was very small amount, so it wasn't long, it was very, very small. So when she was urinating, it was a very small amount, and the first time was like, okay, yeah, I could, and then after about the third time, we asked if she was okay, if she had any pain, because I started to suspect it, me and my partner. And she said that it was stinging when she went to the toilet, and we told our RN at the time, who called her doctor, her doctor, the resident's doctor, and I guess asked for a prescription of antibiotics. But before that, I was told to do a urinalysis on her urine, which I did, and it confirmed that she had a UTI. So her doctor gave her a course of antibiotics, which she started taking, and the RN gave her Euro, which helped her a lot. We started giving her more water to help her and to flush it out even more. She took Euro and water, and she was taking her antibiotics. By the end of the day, the symptoms had gotten a lot better. She wasn't going to the toilet as much. She definitely didn't complain of any more stinging when she voided. Question 2. So work health and safety is also referred to as occupational health and safety, and it's a series of tests. It's a series of assessments and sets of rules, or or guidelines that you have to follow to have a safe environment to work. And it's not just in terms of nursing. It's everywhere. All workplaces should have these guidelines. Obviously, depending on what work you do, it might be a little bit different. So work health and safety is just assessments and guidelines that you must abide by to have a safe environment to work within. When I was working in my first placement, and there was a patient who was overweight, and she was bedbound. I was working in rehab, so she wasn't bedbound because of her overweight. She was bedbound because of her surgery, but because she was overweight, it took she couldn't perform the physio exercises as, I guess, as well. I'm not really sure about physio, but as well as she could have been if she was not overweight. So there was a lot more steps that we had to take for her for her to be able to perform an exercise. And during that, it was one of the exercise that she had to do was stand on her own 2 feet, so put pressure on her feet. And because she was over, she could not, she couldn't pull herself up and stand up. So it was myself, another nurse, because you always need to have 2 nurses when assisting a patient, especially because we were going to use a stand-aid machine, and the physio herself. So we had to get her up from the bed, so myself and the nurse, and to do that we had to do it safely so that our backs aren't hurt, which is like have the bed at our around our waist or a little bit higher, wherever, and one not to pull her up, but more like sit her up a little bit, or actually sit her up a lot, and then just almost guide her to that sitting position rather than pull her up. So that's what we did, and then we strapped on the stand-aid machine strap, and both of us, while I was guiding her back up, like guiding her up, my partner was using the machine, so we both helped her up, which slowly got her to stand her on her own weight, but is also still assisted. Which got her to stand on her own weight, so she do feel the weight, but also she wasn't relying on just her weight, and it helped her to be able to perform other physio exercises, but in a safe manner. Question number 3. If a Muslim, what we need to realize is that Muslim women cover their hair up as a cultural thing. So it's important to be culturally sensitive and culturally aware of why they do it. And why they do it is because they feel this is what I've been told by Muslim women that I do work with, in one of my patients. She said that their hair is their source of beauty, and it's almost sacred. So they cannot. So other men should not be able to see it. Other men, other than their own husband, should not be able to see it. Their husband, or I think their relatives too. So I think their dad and their brothers or sisters, I think they can see it. But the most important thing is stranger men should not be able to see it. So I think that's important to be culturally aware of that. And in terms of her wanting to keep her hijab on, I would advise her that because of infection control protocols, it would not be possible for her to have it on while in the surgical room. So I would advise her to take it off, but I will be providing her with several, and up to 4 or 5 of the surgical caps, so that it's not transparent anymore, because they are very thin. So I would advise her to layer it on so that it's not transparent anymore, or however many she needs, so that her hair cannot be seen, and she can do that just before going into the surgery, so she doesn't have to put it on and then wait in the surgical in the day surgery room before she has to go in. So she can do that just before she has to go in. Question number 4. I would think that the surgery would continue on, because she is a minor, she is under 16, and as by Australian law, if 2 medical officers sign for her advocating that she can go through with the surgery, she can go through with the surgery, because it's also an emergency. It's not an elective surgery, it's more of an it's more of an emergency surgery. So she would still get the surgery, and the mom would be notified when we can reach her. Question number 5. I would approach the lady in a non threatening or judgmental way, and give her something to eat and give her something to drink in a private room or a private space where she could nurse her child.